from the American Academy of Pediatrics.
Keeping up with our teens can be tough. One day they're into one thing, the next day they're not into it at all. And listen, most of these things, these trends, are pretty inconsequential. Artists, fashion trends, etc. But when they get more serious, like substances they may be using, we better pay attention.
But you really need to approach it calmly and be curious. I do think you then also need to pivot and send the message that, look, I don't want you using substances because I'm worried about your health and safety.
Welcome to Healthy Children, the podcast for parents from the American Academy of Pediatrics. I'm Dr. Edith Bracho-Sanchez. I am a pediatrician and a mama figuring it out. This is a judgment-free space where all questions are good questions, and the answers will hopefully be even better. Let's get started. Today, we're talking all about the use of substances in teens. And to do that, I have with me Dr. Scott Hadland, who is the Chief of Adolescent and Young Adult Medicine at Massachusetts General Hospital and an Associate Professor of Pediatrics at Harvard Medical School. He holds triple board certification in general pediatrics, adolescent medicine, and addiction medicine. Scott, welcome.
Thanks for having me.
Yeah, I'm so excited to do this and to have this conversation with you. I think the first thing, Scott, that I'd personally love to know is what is happening nationally when it comes to substance use among teens. Let's start with what substances they're using.
I want to put a positive frame on this because I think if you read the news or if you sort of look around you, it can feel a little bit catastrophic. So, for example, we know that overdose rates in teenagers are at an all-time high. And in fact, overdoses now kill the equivalent of a high school classroom of teenagers every week across the country. And so it's really easy to see a lot of reasons that we need to be concerned, but there actually is a lot of positive news here. And that is that across almost all substances, the rates of teen substance use have declined steadily, really nicely since the 1990s. And so we're actually at a point where really fewer teens than ever before are using any substances at all. And so when you look at, for example, cigarettes, they've declined really nicely. If you look at alcohol, use of alcohol has declined really nicely. Substances like cannabis and vaping have been kind of the more recent challenges. Cannabis has been around for a long time, but it has sort of stayed steady in recent years. Vaping has stayed steady in recent years, although there was a slight decline for the most recent year for which we have data. But the bottom line is that overall, fewer teens are using substances, which is good news. And yet substances are here to stay, and we need to be prepared to address them.
Yeah, I mean, I love that you're framing it this way because I think when you hear news, the things that make it to the news are the crises. And not only that, but they also often lack context. You don't really hear the good news or the declining substance use kind of news or the stable substance use kind of news, right? Like those are not things you hear about. So I love that you started the conversation there. Now, when it comes to alcohol and marijuana, tell us a little bit about what is happening and what you're seeing in your practice, Scott.
Well, starting with cannabis, and cannabis is really marijuana. I just happen to use that word because it is a little bit more scientific and has a little bit less history behind it. But many parents will know cannabis as marijuana or pot or weed or one of the many names that it goes by. When it comes to cannabis, as much as I said before that, many substances are on the decline, cannabis is a substance that is still very commonly used. And the potency of cannabis has actually steadily increased. So even as fewer, young people than ever are using substances, the potency of many substances has actually increased. And actually the potency of cannabis that's available for young people these days has increased a lot. And so one thing that I see a lot clinically is that when I first started my practice, when I was a pediatric resident, actually starting in 2009, people smoked cannabis, right? You would roll a joint and that's what you would smoke. And what has happened over the last 15 or so years is that a number of high potency delivery devices for cannabis have come across the market and have really started to infiltrate young people's use. And so this includes, for example, vape pens or dabbing. These are ways that young people can deliver really high levels of THC that gets into the brain and gets into other parts of their body that really is kind of unprecedented. We see levels of THC reaching the brain that really are not the same as what we used to see 15 years ago when I was first starting practice, and certainly decades ago when many of our listeners might be more familiar with the cannabis that was around decades ago.
Yeah. And why is that, Scott? I mean, it sort of seems like the high cannabis content of some of these products is not going to go down. But how did we get here, Scott, to the best of your, ability to explain?
Well, like any other field or industry, when it comes to drugs, there's innovation, right? And there's sort of increased efficiency. In this case, it's bad efficiency, but it's efficiency whereby you deliver more drug to a consumer for less cost. And that's sort of what has been sort of occurring within the drug markets with cannabis. It's also happened, by the way, for other substances. If you think about nicotine, for example, vaping often delivers high levels of nicotine that, are far surpass what young people used to get through cigarettes. We talked earlier on about opioids. A big part of the opioid overdose crisis is that fentanyl, a really high potency opioid, is what's driving opioid-related overdose deaths and not some of the less potent opioids like oxycodone. So this is kind of a trend that we see across substances. I will say one of the substances that has not seen this to the same degree is alcohol, which you asked about before.
Yeah.
Remember, alcohol is a widely available, but also very highly regulated substance in the United States. And a lot of laws are in place to make sure that alcohol only gets to a certain concentration or a certain percentage and can only be sold and administered to people in certain ways.
Fascinating. So as part of the problem, Scott, that we haven't quite caught up with the regulation of some of these other substances.
I do think that that's a really important thing for us to be considering, right? So when it comes to alcohol, there are often laws around the maximum concentration of alcohol that's allowed to be sold. There aren't those same laws for concentrations of THC. So if a young person is getting a hold of cartridges and then is vaping, the percentage of THC in those cartridges is often 85, 95% or somewhere on that order. And so they're getting really high concentration, really pure THC. And we don't have any laws or policies in place for the most part to put caps on that.
Yeah. Now, Scott, the other thing that we hear about a lot when it comes to the news, right, is the so-called mental health crisis that is happening around the country and really in many ways around the world. I want to ask you, how is mental health playing or not playing a role when it comes to when teens may use something like marijuana or alcohol?
Yeah, it's a really important question because it's so critical that we don't just look at substance use itself, but we actually look at the underlying and root causes of substance use. And mental health is really a key component here. I see it all the time in my clinical practice in the teens that I care for. And I should say that I work in a pediatric primary care clinic where I deliver both primary care to teenagers as well as subspecialty referral care, meaning that other doctors in the area will refer their patients to me to help manage those patients' addiction. And so I see kind of a big swath of things, both on the sort of general primary care front and then on the referral front. And mental health, I really believe this is at the heart of the vast majority of the work that I do. There are data to support this. This is, I think, probably not a surprise, but it is really the rule and not the exception that the patients that I'm caring for who are really struggling with substances have other mental health challenges that they're working through. Most commonly, those challenges are depression, anxiety. In some cases, it might be ADHD or an eating disorder, prior trauma. But the bottom line is mental health is so commonly part of the sort of underlying context in which we see substance use. Now, don't get me wrong. Many young people use substances and don't have a mental health problem.
Of course.
But the patients who really struggle and have a problem very commonly do.
Yeah. And I think that makes intuitive sense to some extent. Now, Scott, with so many things that are changing, drug delivery, the mental health situation of many teens around the country, what is keeping you as a pediatrician who has done a lot of work in this field up at night? And what I mean by that is it alcohol? Is it marijuana? Is it opioids? Is it new substances that are trickling in? Is it the mental health crisis that is keeping you up at night? What worries you as someone who has worked in this field for quite some time now?
Yeah, first and foremost, it's the number of young people who are dying from overdoses, because this is a very real challenge that is really gripping families across our country right now. And the crisis is not letting up. And so I lose a lot of sleep over that. When it comes to other substances, though, that people often perceive as being much less harmful, and they are, right? People don't die, for example, of cannabis overdoses. People don't die from nicotine overdoses. Overdoses involving alcohol are, for the most part, relatively rare unless they're also involving other substances. But they are resulting in enormous challenges for young people and families. And so there's another part of me that stays awake at night, worried that young people who need support, who need help, aren't getting it because our medical system has been woefully undertrained and underdeveloped to help address substance use problems in young people. And so families are constantly, when they have a young person who's struggling, constantly trying to navigate our complex system, trying to find a place to get help, but then being unsuccessful at finding it because we don't have a lot of high quality treatment, especially high quality treatment that involves pediatric experts.
Yeah. Scott, and I want to ask you about our role as pediatricians and our partnership with parents, right? Because I think, listen, I would love for every clinic to have a person like you who is so highly trained and able to help in these situations. But the reality is that parents are most often going to their primary care pediatrician and trying to tackle some of these things in partnership with them, ideally, right? That is sort of best case scenario for most places around the country. So when I, for example, have teens come into my practice, a lot of times families, parents, moms will say, "Doctor, can you please talk to them about drugs?" And it happens with a lot of other topics too, right? Like, can you give them the drug conversation? Can you have the talk with them? And listen, for me, I do have a good relationship with a lot of my families. And at the same time, I'm mindful that I'm only seeing them for a few minutes at a time, sometimes during a yearly physical. So how do you guide families in setting up these conversations with their teens?
Mm-hmm. Well, the first thing I want to do is sort of cut some slack for you as a general pediatrician, for families that, one moment is not going to fix everything or not going to change everything, right? So the teens that I care for who are struggling with substance use, it takes months, sometimes years of working together to really make an impactful change. This can be a tricky problem to address. And part of our job as pediatricians is to be there, hold the hands of our patients and families and go on this journey with them and support them every step of the way, because it can be a long journey. And so we shouldn't pretend that one moment changes everything. But now I'm going to contradict myself because I know busy pediatricians and busy parents don't have a ton of time to really sit down and have extensive talks about drugs. But what they can do is send some simple messages. And so pediatricians, for example, there are data to suggest that when a pediatrician says, "Hey, look, Joey, as your pediatrician, it's really important I tell you that you need to cut back or quit your cannabis use because it's probably causing some harm." That kind of statement is actually more powerful than you might think for somebody who has maybe low level or experimental use, for them to hear that kind of messaging. And I really encourage parents to think about how can they introduce some of this messaging into their lives as well, right? So one issue that we have right now in our society is that when it comes to certain substances like cannabis, for example, there's often a lot of positive talk or a lot of positive messaging around cannabis, right? It's natural. It's not as bad as alcohol.
Right.
It's green. It comes from the earth. It's legal now, right? There's all this positive messaging, and there's not a lot of counter messaging that teens will get. And I think it is really important for parents to send the message that, hey, look, for your health and well-being, I really don't want you to be using substances. Of course, I want you to come to me if you have questions. I want you to feel like you can talk to me if you have used substances, but I really don't want you to use them for your health and safety.
Yeah. Such a strong, simple message that I think we can all incorporate into our busy practices or our busy households, right? Now, Scott, I want to take it one step farther, right? Let's say that your teen in conversation lets it slip that they're drinking or they're smoking weed. What do you say as a parent? Do you say, "I don't approve of you doing that"? Does that shut down the communication and push your teen away? Where is that balance there?
Yeah, this is a tricky dance for parents, right?
Yeah.
It is really important that you don't shut down the conversation right away, right? So it is really important that you don't immediately out of the gate have that moment of saying, oh, you can't do that, or that's bad, or I'm furious at you. Actually, it's really important to take a moment, gather yourself, and have the wherewithal to approach it from some curiosity, right? So, tell me more is a great question that you can ask a young person. Oh, tell me more. How did that happen? Who was there? What had you been thinking about using substances for a while, or had this just sort of come out of nowhere? Trying to understand the context in which it happened, because that information gathering actually is really helpful for some of the prevention that parents can do and some of the steps that they can take to help keep a young person from using again. But you really need to approach it calmly and be curious. I do think you then also need to pivot and send the message that, look, I don't want you using substances because I'm worried about your health and safety.
Yeah.
That also needs to come, but it can come later in the conversation after you've had a moment to approach from a non-judgmental place.
I love the way that you're framing it, Scott, because the way that you're saying it is, I don't want you to use it because I'm worried about your health and safety, meaning I love you, I care about you. This is why I'm saying this, as opposed to don't do that, or I don't approve of this, or a judgment, right? It's more, I care about you, and that's why I don't want you to use this. Is that right?
Right. Yeah. And it's not using moralistic terms, right? It's using care, health, safety as sort of the main points, which, teens and parents can both get behind. The idea here is not to demonize substances or to say that substances are bad, but actually to just highlight over time the reasons that a young person would want to choose not to use substances.
Yeah, I love that. That is so helpful in how we frame these conversations. Now, Scott, I also want to ask you, and this may be me coming from a different culture, as I've shared with our podcast listeners, I was born and raised in Latin America, but you would never, in our household or in my friends' households, be given alcohol. Whether you were supervised or not, it wasn't something that parents facilitated in any way. And then now that I'm here in this country and practicing in this country and raising a child in this country, I've been a little bit shocked personally to find that some parents do actually provide the alcohol and quote unquote supervise. I'm thinking about parents who let their kids drink in the basement, just to sort of state it plainly. How do you feel about these things as the expert?
Yeah, I think that cultural perspective that you bring is really important because it reminds us that for many people, this isn't the norm, right? The idea that you would help young people to drink by actually supplying alcohol and supplying a place to do it, right? I think a lot of parents think that that is going to be safer for their teens and that they should do that. The studies have actually shown that when parents supply alcohol to their teens, those teens then go on to be more likely to have long-term problems with alcohol and addiction. So the studies would tell us that it's really doing the opposite of what we're intending.
I knew it, Scott. I knew it. Now, Scott, so far we talked about the teen who let it slip, right? That they were using substances. What about the teen that doesn't necessarily tell you? What are some signs that we can look for to give us a clue that our teen may have a substance use disorder?
Right. Yeah. A substance use disorder, that's the medical term that we use to describe addiction. And it can be mild or it can be severe or anything kind of in between, right? And the hallmark of addiction or the hallmark of a substance use disorder is not just using substances, but using substances in such a way that it results in negative consequences. And yet you continue to use despite those negative consequences, right? So teens who have a problem with addiction will have loss of control over their use, right? So they might start spending lots of money on it or spending lots of time using substances, become really kind of distracted by them. And so parents might be on the lookout for a change in behavior in which a young person can't explain sort of where their money went, or they might seem to be distracted and closed up in their room for long periods of time or out of the house for long periods of time where there isn't a great explanation. That can all be a suggestion that there might be a substance use disorder going on. And I also said, another thing that can happen are these other negative consequences. And these negative consequences often will show up in school performance that will get worse.
Right.
A teen might be less engaged with their sports team or their sports performance might go down, especially if they're inhaling something that's limiting their lung capacity.
Right.
They might have a change in their group of friends. They might be showing up to school or to work late. And so when you start to see these changes in behavior that might suggest that there's negative consequences going on, I think it's worthwhile asking, could substance use be underlying this?
Yeah, I love that. And I love it as a guide for us as general pediatricians as well, right? Like as we're asking about all of these things, those are some of the red flags that we can look for. And we're going to ask no matter what, but I think our suspicion would go up, right? Now, Scott, at what point would you tell a parent that it's time to look for help? And what would be a good first step for a parent who is worried?
Well, it's never wrong to get help at any time, right? I have parents who come to me before their child has ever used any substance, but because the parent comes from a family that has a history of addiction or may just be worried that their child is at risk for a number of different reasons. Maybe they're struggling with mental health. Maybe they have friends that use substances. There are a lot of parents that bring patients to me, bring their teenager to me to care for them and give them support when they haven't ever used a substance. And that, in my mind, is completely appropriate and legitimate, right? So certainly any level of substance use, you can talk to your pediatrician about. I think that if there's low-level substance use going on, talk to your pediatrician because, as you mentioned before, pediatricians often can be there to talk to a young person about substance use, find out what they're using, find out about things surrounding their safety, right? Are they making sure that if they are drinking, do they have a safe ride? Are they using Ubers or Lyfts to get around rather than somebody getting behind the wheel, right? These are all things that a pediatrician can take on. And if a pediatrician, and pediatricians can help support teens in cutting back or quitting their substance use. And if a pediatrician is worried that there's a more serious problem with addiction, they can help with a referral to a formal treatment program.
Yeah. Scott, I could talk to you about this for hours. We are unfortunately at time. We like to close out our episodes with what we call a parenting prescription. So when it comes to substance use, what is one thing you want all our listeners to know?
I think it's really important for parents to remember the levers that they have, right? So if a young person is using substances and the parent wants to curb that behavior, remember that often we as parents are giving our kids cash, or maybe giving them access to a credit card, or maybe paying for their cell phone, or maybe lending them our car. And we have the power to set a curfew. Actually, we call all of these things the C's, right? The letter C. They all start with the letter C. Parents often have a lot of limits and power that they can exert when they need to curb the behavior of a young person. And so remember that if you're worried about your teen, you have the ability to pull these levers and rein in their behavior by setting expectations and reminding them that many of these things are privileges and not rights, and that they are privileges that a young person should only have if they're using them in the right way.
Such a good reminder. Thank you so much, Dr. Scott Hadland, for joining us today.
Thanks for having me.
And thank you at home for joining us. If you like the Healthy Children podcast, please subscribe on your favorite app and help us spread the word. Follow Healthy Children on Instagram, Facebook, and Threads at Healthy Children AAP, and be sure to visit healthychildren.org, the parenting website of the American Academy of Pediatrics. Healthy Children is a production of the American Academy of Pediatrics. Our creative team includes
Ann Johnsos,
Doug Nagel,
Susan Stevens-Martin,
Laura Alessio,
Jackie Ortega,
Mary Claire Walsh,
Hannah Weston,
Kathy Jewell,
Catherine Beard,
and Garrett Brown.
And our theme music was composed by Doug Nagel. We'll be back next week. I'm Dr. Edith Bracho-Sanchez. Thanks for listening.